Welcome to today's Practice Advantage Pro. Again, talking to residents and fellows about that first employment opportunity. And today I'd like to talk about the interviews. Yes, the interviews. Typically, there are 5 interviews before you land that job. There may be 1, 2, or 3 phone interviews, or maybe you're using Skype, or maybe you're using FaceTime. 2 of them are typically in person, and I like to focus in on the 2 that will be done in person in that 5 interview process. So the first interview typically comes after a couple of phone calls, and you're going to the Emerald City, you're going to the Palace, you're going to the medical practice, and you're going to see it in all its grandeur. Typically, the discussion happens at one of the local sushi restaurants, the steakhouse, or maybe the seafood restaurant. So you're not getting a chance to get behind the curtain on that first interview typically. So here are some questions you might consider asking. Does the group have a business plan in writing? And does it go through the year 2017, 2018, 2020, sometime out in the future? The other question that I might be asking is, am I, the physician, a part of that plan? Is a specialist written into that particular plan? It may not be you by name, obviously, but a physician expansion plan. Next is the marketing plan. So, do they have a plan in place to help you succeed by helping you market yourself as you join that practice? Great question to be asking. Do they do benchmarking? This is just a yes-no question. Do they do benchmarking of the practice internally and externally? Tells you about how they think about themselves from a business standpoint. Do they know their top 5 referral sources? Yes or no? You can ask them to name them, but more it's about, do they know them? I've been in practices where they really don't know their top 5 referral sources and really struggle to get at that. Next question is, what are the trends in referrals? Have the referrals gone up for your specialty? Have they remained flat, or they've gone the other way? There could be some market dynamics going on that you need to know. Maybe a health system bought out one of the primary referral sources and they don't refer to this particular practice. Or maybe one of the main referral sources relocated to another part of the country. You need to understand that a bit. Denials from insurance claim. Do they know the top 5 reasons why they're getting denials? Do they know that it's patient demographic information, or that it's duplicate services, or that it may be a non-covered service? Yes or no on that one, and then they should be able to identify 2 or 3. It should be pretty immediate when they respond to that. Do they know what their collections and their AR days are, accounts receivable days? Is it a trend that's going down so that their accounts receivable days maybe started at 50 and they're at 45, or maybe they're at 45 and they're at 21, whatever that might be. It should be a positive trend over the last 3 years. What's their payer mix? Have there been some employment or employers that have pulled out of the marketplace, so that's changed the payer mix in the marketplace? Important for you to know. And here's one, it's a yes or no, but do they do third-party audits, independent audits of their accounting system, of their coding and billing systems? And if so, how often do they do that? Do they do that on a semi-annual or maybe every couple of year cycle? So some important things to ask while you're in the Emerald City. Now let's get behind the curtain. Let's see what's behind the curtain. Maybe your interview was set up for a Tuesday, and you might want to just stay around Wednesday morning and unannounced show up at the practice at 10 o'clock on Wednesday. 10 o'clock because it's in the morning, they should be busy. You park where the patients park, you enter where the patients enter, you take a look at what's going on when you walk into that particular clinic. Is it busy in the waiting room? Is it disheveled? Whatever that might be. Are you greeted well by the staff? Take an opportunity on a 10 o'clock on a Wednesday to take a look at the environment. The other one is, maybe you want your Aunt Lois or your Uncle Larry to call the practice for you at 7 a.m. to see if it rolls over to the answering service and what that message is like. At 9 a.m., at noon, do they cover the phone at noon and it rolls over to answering? At 3 and at 5, are people slipping out of the office right away? The reason why this is important, patient access for you, the new doc, is really important. So you want to make sure that phone is getting answered in a way that makes sense for you. More behind the curtain. Do they do staff introductions during the course of your interview? And if so, are those cordial and welcoming? Do you meet all the docs that you might be working directly with? Now, it may be a large group and you don't work directly with all of them, but at least the key physicians, you need to meet them in person, even if it's a 5-minute handshake. Practice management. Who is their practice manager or administrator, and what are their qualifications? Do they have an MGMA affiliation, Medical Group Management Association, or other professional affiliation that can help them do their day-to-day job? Turnover rate, appreciative inquiry, electronic medical records, and here's one: your reputation goes with that of those people practicing at that particular location. You might want to do a quick background check through the medical societies and associations to see what that particular physician's reputation might be, because your reputation goes with theirs. Thank you for joining us for today's Practice Advantage Pearl. We're just giving you a little look behind the curtain and some encouragement to make sure you ask some questions when you get to the palace. Thank you.